In the late 1990s, Uganda was already pioneering what was later to become the Paris Principles, also in the health sector.
In the early 2000s, Uganda was seen as a model country.
The new principles were put in place to tackle the problems of fragmentation and poor coordination experienced by many developing countries, including Uganda.
We had already seen that many projects, many programs we were operating were running in silos, and there wasn't adequate horizontal coordination, and we could see inefficiencies coming up. And of course, the ultimate results, the impact on the ground was not what we had desired.
If you do project support, you can help a lot of people to get access to better health services. But it will be like small islands everywhere. But if you really want to make an impact and have a stronger impact on the health of people in the whole country, it's better to join forces with others and try to make sure that it's actually the Ugandan government who should do those things.
Uganda welcomes the shift from project support to a sector-wide approach.
When we talk together as donors, we get a landscape vision, a holistic approach towards healthcare delivery. And as such, we look at the synergism of some of the activities we choose. We look at how activities can complement each other for greater benefits of the society. And this may not happen when you are dealing with one donor.
The improved cooperation has improved impact on the ground.
I think overall, if we look at the performance of the health sector over the past 10 years, definitely there has been enormous improvements in many areas.
There has been an impact on the ground. Of course, there are challenges which have been coming along as we move, and those are the ones which keep us busy to sort out.
The overarching challenge of the health sector in Uganda is lack of funds.
We have to realize that the sector is underfinanced. There is simply not enough money.
Uganda's government spending on health has grown, but the growth does not match the impressive economic growth in Uganda in general.
There was a promise that should the economy improve abruptly, then there would be what? Commensurate increase in health sector budget. This one we have not seen.
Also, the way donors disperse their funding for the health sector has caused difficulties.
In the development partner aspect, or the donor funding, we have seen lots of fluctuation.
Annual donor funding for health in Uganda over the past 5 years varies from $140 million to well over $500 million. But the sector not only suffers from lack of funds, the evaluation also points to lack of national leadership.
We see that for a while there were very, very regular changes in top leadership of the health sector. I mean, there was no permanent secretary who had been there for more than a year. And we saw, from a strategic point of view, it is necessary for that person to hold and lead the strategic direction of the sector. We saw that as not being there.
Another challenge still remaining in spite of improved cooperation is fragmentation of the health sector.
There is still fragmentation just because we still have development partners who have not come fully on the table, notably the United States supported agencies. By virtue of the State Department rules and regulations, policies back home, a lot of money is coming through that, and it comes to support programs, especially on HIV/AIDS.
From a U.S. government perspective, we do have regulations and policies of our Congress that we must follow, and they're in place to ensure good accountability of U.S. taxpayer dollars. And they're also there in part because the U.S. government, for example, in Uganda is the largest development partner active in the health sector in terms of dollars invested. And so it's partially accountability, but it is also, I believe, the desire of the U.S. government to see the large investments it's making in countries like Uganda show results.
For better results, it is urgent to address the challenges in the health sector.
Pressure on us is really, really insurmountable. We are beginning to feel it very badly because at the growth of 3.2% per annum. That is 1.4 million babies arriving in this country, of course, with the social amenities and services required. We need to have a budget that matches that kind of increase.